Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Also, Ka says, I'm so defeated. My son started medication before his ADHD and has tried several. They all make him emotional, aggressive, and irritable. But they go on to say he started ABA yesterday, which is great, but that she had to go pick him up because he had a meltdown. Now, this sends off some warning things for me. Talk to us, Dr. Granpeesheh.
A couple of different things. So it's very difficult when you are struggling with ADHD on top of autism. So first thing, these are steps I'd love you to take. First thing is, please make sure your child actually has an accurate diagnosis of ADHD. This is super, super important because there's a whole kind of difficulty to attend aspect of autism itself. But ADHD you have to have a specific set of symptoms off of a very long checklist. And there's two different types of ADHD, right? Inattentive and hyperactive. And I want you to you can actually probably get a hold of the symptoms of ADHD on Google if you Google them. I just want you to make sure, because if you doesn't, and if we're just dealing with the autism, then I would not even try the ADHD meds, okay? Because they are stimulants, right? We're talking Adderall, Ritalin, Vyvanse, those types of medications, and they are stimulants. And if you are not, if you don't have ADHD or hyperactivity in particular, they will make you emotional and aggressive and irritable. There's no question. I actually tried it one time because I was a very young child of mine who was one of my patients had just started it. And I was like, why is this making him so irritable? And let me tell you, it makes your heart rate go up. It's just like everything seems, like a lot of young people, I think they try to take these medications in order to like stay up all night and study, right? So it is a very hyper making drug. And the only reason that it works with some children with ADHD is that, yes, it helps them focus. And truthfully, it kind of burns out their hyperactivity because it keeps their like blood pressure so high that they burn out, so they calm down a little bit. So it's not my favorite medication, but it is very effective for things like paying attention. Let's make sure that he actually does have an ADHD diagnosis. Then you need to make sure that you stay in very frequent contact with your psychiatrist who diagnosed or who gave you the meds, because these drugs come in multiple different doses. And if it's very difficult for him to adjust, they can go to a lower dose and start to build it up very, very slowly. Okay, so a lot of people do that. So it's very important. Now we're talking about the ABA side of it. So one of the things that I'm going to try my best to explain here, but it's a little difficult. So just remove the whole concept of him becoming irritable from medication. Just put that aside for a sec. And let's just talk about just the reaction, right? So for whatever reason, any of us can get emotional or aggressive. And when we do, and someone calls mom and mom comes and picks us up and then we get to go home, what the message that we're getting is me becoming aggressive is pretty powerful and it works. And every time I want to get out of school or out of ABA, I will tantrum and mom will come and take me, right? And so that is ABA. It's essentially a consequence that helps us escape a situation, increases the behavior that came before the escape, right? So tantruming, I get to leave, this is going to happen forever. So this is important because the message that he's getting is that I can tantrum and I'll get out of here. Now, let's go back to reality, which is you just put him on a medication that is causing him to be more irritable. So now you look at the whole scenario and it's like, let's give him this medication, which makes him more irritable. Then the poor guy has a tantrum or becomes aggressive, and now we rescue him. This whole thing is not working. It's not good. So my recommendation is two things. One is reduce the dosage. First of all, talk to the doctor, reduce the dosage, and talk to your ABA people to make sure of two things. One is make the program very easy. Like, in other words, as easy as possible. The most basic stuff, even if he knows the stuff, go back to things he knows so that it is pleasant, so that they get an opportunity to reward him very, very frequently in ABA. Because sometimes in ABA, what you have to do is just like reward, so the child actually starts to enjoy it, right? Because it's going to be a lot of demand. So do that. And if they see him getting irritable, have them teach him to say, I need a break. I need a break. Before he has a tantrum, before he gets irritable or to the point where he is aggressive. So, and that might be that they just get to do something with him for, I don't know, 30 seconds, and then he needs a minute break, 30 seconds, minute break, whatever the baseline is, doesn't matter. The point is, we don't want him to get to a point where he's aggressive, because then you have to come rescue him. You know what I mean? So make the whole thing a lot more pleasant and easier and filled with reinforcers. And then they have to be very good at recognizing the signs so that before he gets irritable, they model for him, they prompt for him, and he asks for a break. Then he gets a break. And if he gets enough breaks, he's not going to need you to come and rescue him, because it'll be a lot more pleasant for him overall. Hopefully that makes sense, Shannon.
Yes. Can we take just a second though and talk about emotions? Because I was raised by wonderful people who were raised by wonderful people, and no one taught anyone how to deal with an emotion. And the way I was raised, just keeping it real, is if you're having any emotion, whether it's joy or sadness or whatever, eat, and then it'll kind of level it out. Right. And that was it. And for heaven's sake, if you were having an emotion, let's try to like change whatever the equation is right then, right there, not dealing with it and writing out the emotion to get to an end. There's a video that I watched a couple of years ago, and it was so painful me to watch. It was a little boy who was doing an exhibition. It was like their final class for a karate class, and all the other kids came up and they karate chopped the board, and it was his turn, and he came up and it didn't break. And then he was like, I don't want to do it. I don't want to do it. Please don't make me do it. And the teacher came over and said, it's okay. You're going to be able to do it. And the other kids gathered around and like, you can do it. And the kid was like, no, I don't want to. Now, how I was raised, and as a mother, can I be honest and say, I would have been like, that's enough. Stop it. And tried to pull the child out of it, because I can't bear for anybody to be uncomfortable. Because I wasn't taught those skills. The teacher, thank God, was somebody who knew, let's not make this a moment that follows him throughout his whole life. They let him stay in the moment, have his emotions, and they said, it's okay. You're feeling sad that you didn't do it the first time, but you can do it. So we're going to try it again. The kid tried it again, still didn't break it. And he was like, please don't make me do it. And everybody's watching him. Yeah. And if the parent had pulled him out then, this guy would have been in therapy when he was 50, figuring out, my whole life has been shaped by the fact that I couldn't hit that board. But the teacher said, no, we're not letting it go. You're feeling sad. You're feeling all this emotion. We're going to help you to do it. And so he chopped the board, and everyone cheered and picked the kid up. And it became this triumph moment in his life, that he had a moment of adversity, worked all the way through it to the end, and resolved it.
Yep.
And I could just watch that kid's life being better than if it had been frozen in time. And I just want to say to myself and everybody watching, sometimes when we see our kids frustrated or upset, we go, stop, please stop. And we don't allow them to get through all of the emotion to the end, where they see, oh, I had emotion. I was upset. We dealt with it. I lived through it. I learned how to calm myself, and I learned how to continue on, which is a much more valuable life skill.
That is also very, very true, Shannon. It's so important to, and unfortunately, and this is a great opportunity for him to actually learn this because he's with ABA folks. A lot of times our kids start to show these emotions in school, and then everyone panics, right? And then everything changes. So you're absolutely right. This is a really good, safe environment where he can learn about emotion as well.
Yeah.
And I saw another comment where mom is saying that she felt guilty because she thought she rewarded it. Don't feel guilty about that. This is we're moms or dads. We rescue our kids. Period.
Yes.
That's our job. We're born to do that. You know what I
Yes.
mean? So don't feel bad about that at all. And you will always rescue him. All that has to happen is that the ABA, for two things actually has to happen. One is the ABA folks need to teach your child how to ask for you more appropriately or how to ask for breaks more appropriately. That's all the self-regulation stuff that's important as well. Our kids learn that, my favorite example of this, Shannon, is when Jem would tell you, I think you need to eat something.
Yes.
You're getting a little hypoglycemic.
I think you should calm down until you eat something. Yes. Because I would miss lunch and he would be like, I think before you say anything else, you should have something to drink and eat and calm down.
I love that so much.
Yeah.
Because that's like amazing. That's a life lesson, right?
Yeah.
Forever. So and the second thing again that has to happen is they need to make sure his entire universe is fair. And give me a stimulant and start trying to teach me something, I'm going to become aggressive, I promise you.
Yeah.
So we got to do it very slowly so his body adjusts to it, and the ABA folks have to give him easy stuff, lots of reinforcers. They can gradually make the demand higher, but very, very slowly.
Yeah. And I don't, we don't know everything that went on and why they called and had you come and get him and everything. But I would push that, if it were me, Dr. Granpeesheh, I would push that ABA provider and be saying to them, let's change this equation because it's not your fault that they did that. And we don't know everything that was going on. But
in fact, make sure that you
it would be much better
that
if they didn't do that.
subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.